Hello everyone, and welcome to the Seay Wellness Experience. I'm Dr. Adam Seay. In this video, I'm going to explain a little bit about what I do in my office, kind of take you through an experience that you would have on the first day, second day, and throughout treatment, so you get a better insight as to what I do in my office. To give you a little bit of background about myself, I am a board-certified chiropractic physician, been in private practice since 2005 in North Carolina, and my practice focuses mainly on applied kinesiology, functional medicine, and on functional neurology. The purpose of this video again is to give you some insight as to what I do for treatment in my office and kind of take you through that process. My mission is to bring wellness to the world. My vision is to transform lives physically, emotionally, and spiritually, and to balance your brain is also my goal. Is to do that, to balance your brain, to reduce toxins in your body, and to enhance your outlook on life. So let's look at what your first visit is like. Day one is going to be a new patient evaluation. You usually call our office, set up an appointment, fill out some paperwork, bring that in. You can also feel free to bring in any lab work as well, and we'll be happy to go over that with you. First thing we do is, or first thing I want to do is get what your health goals are, so we establish that first and foremost, and how your current problem is wrecking your life. We also look at a detailed history to get us the best snapshot of what's happening to you. We do your vitals, we do blood pressure, height, weight, and temperature. We also do a neurologic test, go through several of those to see what your brain is showing us where problems are. We would do orthopedic tests to see what's happening from a structural standpoint. And we also do a foot scan, and the foot is the foundation for the body. We have to look at the feet in order to enhance how the body works and how you move. We also do a functional assessment evaluation where we look at some functional movement. We do a postural analysis using some technology that can measure how far your head's forward, how far your shoulders have shifted. It's pretty neat. We'll go over a little bit about this as well. We also do a urine screen. We can do blood, pH, leukocytes. We can also look at nitrites, protein, glucose. Can test for oxidative stress through a test called Medioxy test. And we also look at ascorbic acid or vitamin C to see if there's a deficiency there. We also do a salivary screen for nitric oxide, and this usually tells us a little bit about your nitric oxide status and what's happening in that regard. In some cases we will refer you out for x-rays. X-rays are vital not only to rule out certain conditions and problems, but also to see what your alignment looks like, see what your posture looks like, and your curvature. So we do some curve analysis as well. And then depending on the case, we may do treatment that first day. A new patient evaluation appointment time is typically anywhere from 30 to 45 minutes depending on the condition and severity of the condition. And your next visit usually is your report of findings, that we'll go over that with you on the next visit and go over and explain everything that we did on day one. So let's look at day two, which is that report of findings. Report of findings, I'm going to discuss your exam. We're going to go over your urine and salivary findings. We're also going to look at your postural assessment and analyze x-rays if they are back in time. And I'm going to give you my recommendations, and I'm going to let you decide what path and plan you want to go down with. Depending on what your treatment goals and health condition is, you may require more treatment than someone who is maybe not as severe. And I do ask that your spouse attend, because we're going over important health information and it's hard to make a decision a lot of times with the spouse isn't there, and it's hard to convey that same material back to the spouse, and you may miss a lot of pieces and there can be a lot of confusion. So we just want to clear out any confusion that might be there. In my office, I offer 4 types of care. We go through acute care. We see that kind of trauma cases. We also look at corrective care. We also do maintenance care. We also do total wellness care. And I'll explain a little bit about each one. Acute care involves trauma or any other type of acute pain that you may be dealing with. Treatment is aimed at providing pain relief, and this type of care does tend to reoccur because the cause is not addressed. So this is typically what we see a lot in chiropractic offices. A person comes in, they're hurting. Doc, I just want you to get me out of pain. We get them out of pain. We don't see them again for a couple of weeks, couple of months down the road. New pain pops up. We see them. Sometimes it's in the same area that they came in for originally. So again, kind of putting a band-aid over everything, but we do offer that type of care for you. Some treatment that we do in acute care, we do chiropractic adjusting. And what a chiropractic adjustment aims to do is to restore joint mobility and improve function to the nervous system And this is the one system that coordinates and controls every aspect of your body. So again, we want to get this system functioning better so you can perform better and function optimally. So here's the spinal nerve chart, and you can kind of see on the chart, it kind of takes you through where the nerves come out, and then here's the nerve root levels. And it's hard to see, I know, because it's small on the screen, but cervical spine will innervate the eyes, it'll get the lungs, the heart, part of the liver. Those things kind of all coordinated and controlled by that part, parotid gland. Thoracic spine, we're going to get into liver, we'll see spleen, kidney health. Get to lumbar spine, we see the intestines, we see the reproductive organs. Getting down lower into the sacrum, we do see genitalia being partly with that bladder as well. So again, we want to influence the spine to in turn influence what it fires to, which is organs. And we want to keep your health up and running by keeping your nervous system healthy. And I like this quote. This was done by Roger Sperry, who was a Nobel laureate, and he said or demonstrated that 90% of the energy entering the brain is from the spine. And the more mechanically distorted a person is, the less energy available for thinking, metabolism, and healing. So again, we have to look to the spine to get you better. In every case, and just about every patient that wants it, we adjust them in our office. To go into another type of treatment that we offer is soft tissue therapy. And this reduces scar tissue formation in muscles, tendons, ligaments, and it restores muscle function. Some of the things that I use, we incorporate active release technique. We also use a percussor. Sometimes we may do PNF stretching. Other things to just kind of really break up any scar tissue that may be present in the muscle or tissues. We also offer muscle stimulation, and this is a technique or a device that sends an electrical signal to the brain to release enkephalins and endorphins to modulate pain. And devices can be anything from TENS units to interferential devices to microcurrent, several different things that we offer in the office to help improve pain, decrease it. Another acute treatment that we offer is laser. Laser helps speed healing. This also does reduce pain through cell-to-cell communication, and it utilizes frequency modulation. So we can actually punch in frequencies to the laser, and the light will come out in addition to the frequency. Laser I mainly use in my office is the Zirconia PL5000. Has market clearance through the FDA for chronic pain, so it does work very well in decreasing pain. Typical treatment can be 2 to 3 visits per week for about 4 to 8 weeks. Typically that's if you have a strain or a sprain. It's going to take about that length of time to get that better, so we definitely want you to be undergoing treatment during that time. There is insurance coverage here, and there are cash plans available for those that may not qualify or have insurance. We can definitely work with you and help you get out of your pain and get you on to the next phase. Second thing that we look at in our office is corrective care. And corrective care goes a lot deeper. This involves correcting the cause of your problem or your pain. Treatment is aimed at restoring function to the nervous system by changing curvatures. And this type of care has the best likelihood of stopping that reoccurrent process that you're in, that vicious cycle of having pain, getting over it, coming back, and having to do this whole song and dance over and over again. In corrective care treatment, we do a chiropractic adjustment. Again, same type of thing. This is going to improve joint mobility, improves firing back to the nervous system, and again, that's the one system that controls everything about your body. We're going to do postural exercises. This provides structural correction and it strengthens the body, and it's based upon your postural analysis. So again, we'll go over this postural screen that we do, and then what we, based on what that shows, this is some exercises that we have a person go through. So this is an example of a screen. This person actually, you can kind of see some pelvic or shoulder tilting. You can see some shifting and rotation and tilt that's in the head. You can see the pelvis is unleveled as well. Looking at the person from the side, you can see how their body's shifted forward. You can also see they have pretty substantial head forward posture as well. So this again is a nice tool that we can use to see what your posture looks like, and then you also get to see it because we don't always get to see that from a static standpoint. And then we also have a report that comes out, and what it does, it tells us how far, based on physics, how far your head's forward, how far your shoulders have shifted, your rib cage, your pelvis, and then a lot of times it gives us an analysis. Like for this person, based on their weight, their head weighs approximately 9.5 pounds, and it has shifted 2.33 inches forward. and based on their physics, their head now effectively weighs 31.7 pounds instead of 9.5. So again, you see why people can have headaches, can have other issues that come about from too much pressure and tension on the muscles and on the tissues. We definitely want to take you through correction and exercises to improve that, to change your posture. And this is another way that we utilize your progress too, to see what your progress is as you're going through treatment. Another type of corrective care treatment we do in our office is stabilizing orthotics. And these support the feet, the knees, the hips, and the spine. They do it through the feet. They provide ongoing support to allow you to hold your adjustments and to improve proprioceptive input to the nervous system. So we a lot of times do a functional squat test, and we kind of test to see if you're going to benefit from these as well. And that's a test that we do on day 1 during your exam. And again, pronation is the most common presentation of the foot. And here are some of the five flags that we look at for pronation. You can have foot flare during your gait cycle, seeing the foot kind of come out to the side. You can see internal knee rotation, and this is things that we look at during your evaluation. A lot of times we look at your Achilles tendon to see if it's bowing inward. If we see a bowed Achilles tendon, we know that is a sign of pronation. We can also see a flat foot, and that's another thing that is a sign of pronation. So all of these together, in addition to an uneven shoe wear, and a lot of times we do look at that. It doesn't mean shoe wear in general, it just means an imbalance from right versus left. If we see an uneven shoe wear, that's another sign that your foot is pronated. So again, you can see what that does. It causes the knee to rotate, the pelvis tilts, the shoulder drops. Looks very similar to that postural screen that we did. And then again, we want to balance the feet because the feet's going to influence all of this. We also go into curve correction. Curve correction improves oxygen and stimulation to the brain. It also decreases excessive forces on the spine, and it improves your posture. I utilize in my office the neck deck. This is something we have you do at home, and sometimes we also can give you the posture pump, and the posture pump works very well also in improving curvature. We can do this both in the neck and the lumbar spine. You must also rehab the cerebellum in order to correct the curve. And a lot of doctors that are doing curve correction, they forget about the cerebellum. The cerebellum has to be rehabbed because your cerebellum, which is part of your brain, coordinates and controls all your movement, and it controls your spinal intrinsic muscles. So if your spinal intrinsic muscles are not firing well, we can hammer curves all day long, but until we get the cerebellum back up and running, then things will really shift and change. So that's one of the things that we do utilize in my office. Here's an example of someone's curve and the analysis that's done on it. The green line is where their arc should be, where those end plates should be lining up, and you can see where theirs is. The red line kind of shows where their curve actually is. And then follow up with treatment. Here's actually some changes that are happening in this particular individual. You see their lines getting closer to their arc. So again, this is something that we can see from a tangible aspect of seeing that curve correct if we do the right things, and that's one of the things that we do during corrective care. Here it is in the lower back. You can see again the red line is where that person is, and the green is where we want them to be, and you can see how that has become a little bit more of a match between the two. So again, this improves so many different aspects of your life. Improves your posture, improves the way your nervous system fires and functions, and you can see some pretty tremendous changes in people. Typical treatment length can be up to 12 months, just depending on what your curves look like, what your posture looks like, because correction does take time. There is insurance coverage here as well, and there are payment plans available, so we can work within any financial capacity that you want us to work. The next phase of care that we go into is maintenance, and this is involving maintaining your posture, your flexibility, and your spinal health. And treatment is focused on preserving all the work you've done during that corrective phase of care. And this type of care provides you with ongoing health benefits. So again, it's far better to maintain something than it is to have to go through something when it's really traumatic. What we do in maintenance care is we do offer chiropractic adjustments. We do that throughout. We also offer soft tissue therapy if needed, if things pop up that need addressing. We do also continue on with postural exercises. You continue to do those at home as well because that's the way that you maintain things. You have to continue to do them. And then we periodically check your spinal or stabilizing orthotics. In some cases you may need a new pair, and we can get you connected with that as well as you maintain your spinal health. Total wellness care is kind of completely different, but we utilize a lot of the same things. This involves nutritional support. We also go into laboratory testing. We do detoxification. We address emotions. We work on balancing your brain through brain-based therapies. We do structural care, and we also balance electromagnetic fields that you're coming in contact with all the time. Treatment focuses on restoring the body back to optimal health, and this type of care gets to the source of your health problems. So this is where we're getting to the heart and soul of what is going on. In total wellness care, we kind of split them kind of into two components. First component is neurostructural care. And what we do here is we do the same thing that we do throughout all of treatment. Chiropractic manipulation, chiropractic adjusting really helps the nervous system. Very, very good on that. We also do brain-based therapies. We'll explain a little bit about this in just a few minutes. Also continue to do soft tissue therapy. We also do laser and another device called Rebuilder, which I'll explain a little bit more about that. The other component is metabolic care. And again, we cannot stress the importance of this enough. If you kind of think of your house as on fire and your brain is the home and inflammation is the fire, the metabolic care and aspect is going to be the fire department. We got to come in and put the fire out. And then once we do, we can rehab and build that brain so much better, but we usually have to address metabolic aspects. And that involves detoxifying the body, involves looking at nutritional support through supplementation, through diet, go into lab testing as well, because it points us in the direction of where your problems are and what needs to be prioritized. We also look at EMF balancing again, because this is a huge problem. We don't feel it, we don't see it, but it's wreaking havoc on our bodies. And emotions as well. Even the CDC recognizes 85% of diseases have an emotional tie to them. So again, we have to address emotions for your body to ultimately heal. To go back through Rebuilder, this is a device that we use in our office, and it emits a 7.83 hertz frequency into the body, and this improves the frequency of firing back to your brain. So it kind of wakes the nerves up. This is really, really good on peripheral neuropathy or any type of neuropathy you may have in the hands. Good for pain as well. We see it a lot with knee pain, back pain, hip pain, arm pain, numbness, tingling. Fall prevention, very good too, especially for elderly. Right now, #1 cause of death among the elderly are falls. We also go into brain-based therapies. To give you a little bit of background or a little bit of input about what that is, this involves multiple therapies that target specific areas of the brain and the cerebellum. So from your evaluation, we do target the brain, we do testing, and we see what areas are weak and underperforming, and then we work on getting those better. Some of the techniques that we use, we can do optokinetic tape, OPK, you can do spin therapy, you can use the Chi machine, you can do vibration therapy, you can do exercise with oxygen therapy, and these are just a few examples of some of the things that we do. And again, it's targeted specifically to the areas of your nervous system that need it. Nutritional testing and lab work. And this again is going to uncover some functional deficits in your body through testing blood. We can test stool, urine, saliva, and hair. So all of these aspects will tell us what your body has defects and deficiencies in. We use multiple different laboratories to do this. We use applied kinesiology as well to find your deficiencies and improve upon those. The other aspect that we look at is detoxification, and this employs the use of nutritional support. We look at epigenetic components as well and energetics to reduce the toxic load on your body. We use the EB Pro, which is a detox foot bath. It's an energetic cleanse that we use. We use supplementation as well. We do foot baths at home that they have the person do. And we also go into genetic testing because we have to see what your ability to detoxify is and what things we need to utilize to improve your detoxification ability that you may have from a genetic standpoint. EMF balancing, again, this is vital because it improves your overall health by reducing harmful electromagnetic field that we're coming into contact with everywhere. EMF radiation is a silent killer and it must be addressed, and that's why we address it. I use the Hedron Q-Disc. We have some other harmonizing devices that we connect you with, and some people that can come into your home and actually help you remediate the electromagnetic field. So treatment time can be up to 1 year, just depending on the severity of your case. Could be as small as 3 months. So again, just depends on when we look at your evaluation as to what your body's showing us. Insurance does offer some coverage here as well, and payment plans are available. So again, we work within any financial capacity that you want us to work. So whatever your health goals may be, we've got a plan that fits every one of those. So I definitely think we can help you with it. My office is currently in network with the following insurance companies. We do accept Blue Cross and Blue Shield, both across the United States and federal. Cigna is one of those that we are in network with. MedCost as well. Medicare has very, very limited coverage, spine manipulation only. Anything outside of that is deemed not medically necessary. Primary physician care and HealthSpring are the current ones that we are in network with. And because insurance only offers partial coverage across the board, I offer several payment options and plans that are available in my office. We currently use Advanced Care Card and an auto debit program that will allow you to finance that interest-free. I want to go over a little bit about insanity. Insanity is continuing to do the same thing while expecting a different outcome. And you're probably sitting back watching this saying, yes, that's me. I've been going through the medical route, been doing all the same things over and over again, and still dealing with the same problem. Nothing's correcting, nothing's getting better. And it's because you are living in the definition of insanity. Medicine only offers symptomatic relief. They never cure anything. And if we look at that, we see that with diabetes. If it truly cured diabetes, they wouldn't need the medicine anymore, but it never does. And a good analogy too is if you can put a pretty nice sized pebble in your shoe and you go and put your shoe on, you realize, man, that starts to hurt if you stand on it for a period of time. You can go to the doctor's office, they can give you some narcotics. You start taking the narcotics, and then you know what? I don't have foot pain anymore. But did it really get to the root cause of your problem? Well, a simple fix would be take the stone out of your shoe. You'd feel a lot better, and you'd get to the root cause of that. So again, medicine a lot of times offers symptomatic relief, and it masks those symptoms. I want you to, if you're willing to, I want you to stop the insanity. I want you to give our office a call. What has this cost you in relationship to time, to money, in your relationships, and your happiness? Is it preventing you from doing the things that you see other people do because you're living a life of pain or you're suffering? Again, if you're ready to end your health crisis and start on a journey of optimal well-being, give my office a call today. Our number is 919-662-0520, and I look forward to seeing you. Thank you.